5 years ago, looking at these Mendelian randomization studies, I kind of went, I can't hold this position anymore.
What is your revised position on LDL?
So if you look at the research, HDL is important because it's a marker of metabolic health. If you have high HDL, it suggests that you are metabolically quite healthy. You very rarely will you have high HDL and like high CRP, which is an inflammatory marker, or dysregulated blood glucose. Almost exclusively people who have high HDL will have good biomarkers of metabolic health. But if you take drugs that raise HDL, it doesn't reduce your risk of cardiovascular disease. In Mendelian randomization studies, which Mendelian randomization basically uses natural randomization. So some people are, in the case of HDL, naturally higher secretors or naturally lower secretors of HDL. And, we talked about how you can't really do a 20-year human randomized control trial. And when you're trying to examine something like heart disease, that is a lifetime exposure issue. It's very unlikely that you're going to pick out differences between treatments in 2 years or even 5 years. People typically don't develop heart disease until they're in their 50s, 60s, and 70s. What Mendelian randomization allows is to say, okay, we have these people who naturally secrete more or less, so we can stratify those and look at what is their risk. So if you look at people who are low secretors of HDL versus high secretors of HDL, with holding some of the other key variables consistent like LDL, you don't see an effect on heart disease really.
Of LDL?
Of HDL.
Got it. Okay.
But when you look at LDL and you look at the lifetime exposure to LDL, it is like a linear effect on heart disease. And we know that it's actually not so much LDL, but it's more apolipoprotein B, but that tends to track with LDL just in general. And if you look at the mechanism, we know that LDL can penetrate the endothelium. So there's the mechanism is present. If we look at the epidemiology, it supports that it's an independent risk factor. And then again, these Mendelian randomization studies where we can kind of look at people's exposure over a lifetime, and then we see that linear kind of dose-dependent effect. To me, that was convincing enough to change my mind on that particular topic.